plan have they formulated that allows them to add, by my count, 9 or 10 million, by their count, 47 million, new people looking for health care without adding doctors and nurses? And how is that going to make the cost of health care go down?
Hello, my name is Tony Randazzo. I'm from Union, Missouri, formerly from North County. That was my wife, Judy, that was up here earlier. Earlier this year, actually New Year's Day, I collapsed in our front yard with a heart attack. And good thing I'm married to this one. After I went through my little experience, I kind of became, I thought, you know, I kind of faced reality, and so I'm not so much concerned anymore with what I say. I'm respectful, but I don't hold back any longer. And my concerns are, folks, you gotta listen to the language. You gotta listen to the words. You gotta listen to how they say the words, and you have to parse them. They'll tell you when you start parsing them, don't parse my words. But you got to listen to every nuance that this administration says. It's not health care reform, it's insurance takeover. To further make matters interesting, in February, on my second week back of limited duty, I found out that I had 30 days and my job was eliminated. But that's okay. I don't want anybody to feel sorry for me. Because you're right, I have COVID. And so I'm not without health care, and neither is my wife. But that being said, you know, and I'll get a job. I'm not worried about it. You know, I don't want anybody to feel sorry for me. But like I said, once more, I don't care so much about you know, what I say anymore. I'm going to say my opinion. Two issues take back to Senator McCaskill. Number one, and this is something, and my wife is going to be happy when I mention this, but there's a little bill out there that's going to be proposed called the Global Poverty Act. And the Global Poverty Act is going to allocate $845 billion to the UN. And it's tied in with cap and trade. So you got to read that one, because it's in there. Obama sent it through in 2007, but they pulled it off because they wanted him to make sure he got elected. So I want to know what Claire McCaskill's position on Global Poverty Act is going to be when that comes up sooner or later. In the fall. But as part of my saying what I think, it's quite simple. We've heard from people around here that they call their congressmen, they call their senators across the country, and they get laughed at. They get laughed at, they get made fun of. But the people are mad, and it's time for everybody to stand up and get mad. Get mad. Because we're not contained anymore. I don't want Obama in my house telling me what I can and can't do, what I can and can't drink, what I can and can't eat, what kind of car I can drive, what I got to put in that car. I don't want them in my business anywhere that they have to be. And to hear the comments that we heard earlier, I'm in retail. I've been in retail for 32 years, and when we hire an employee, we tell them, plan out, we have every faith that you're going to do the good job. But if you don't, we're going to elevate you to customer. We're going to promote you to customer if you don't do a good job. Senator McCaskill is going to get elected to private citizen if she doesn't start listening to us.
I did not vote for Obama, but I do want to point out it's not just Obama and it's not just Democrats. It's a lifelong Republican. I'm sick of them all. all right? It is said that people who don't learn from their past mistakes are doomed to repeat them. This is a long-known adage in civilization. In 1965, Senator Alan Ellender, a Democrat from Louisiana, stated, "Let us not be so naive as to believe that the Medicare program will not be increased from year to year to the point that the government will have to impose more taxes on the little man or else take the necessary money out of the Treasury." Well, see what's happened 40 years later? Payroll taxes have steadily increased. And instead of putting the money away as they were supposed to, save it, they squandered it to the point where these programs are near bankruptcy. Please should heed Senator Ellender's words. This is the future of a government-run healthcare plan. Will Senator McCaskill commit to fixing Medicare, Medicaid, and Social Security before imposing a new healthcare plan on the American taxpayer who's already overburdened? This is what we have before we try something else. And to the physicians that were here, I really do appreciate the 3 or 4 of you that were here. I'd like to suggest that you associate yourself with the American Medical Association. We came out